Alright, my name's Savannah. I'm your nurse today. I'm going to do your physical assessment. Is there any questions you have before I start? Okay, so I've already done hand hygiene. I've washed my hands. We've already taken your vital signs. Your temperature was 96.5, which is on the colder side, but you did state you were feeling cool. Pulse was 80, which is normal. Your blood pressure was 110/70. O2 was 95, and you rated your pain 7 out of 10. And that's because you burned your hand.
I burned
recently.
my hand, yeah, just for this occasion.
Okay. So we're going to start with your level of consciousness. So if you can tell me what your name is.
Russell Meyer,
And what city are we in right now?
the Sherwoods,
Sherwood,
Arkansas.
Arkansas. And what are we doing at the moment?
I'm trying to fix my hand, and you're trying to do an assessment.
Okay, good. Alright, so we are alert and oriented. And what year is it?
2020.
Times 4. Okay, so right now you are calm, you're cooperative, so your mood is satisfactory to do this assessment. So we're going to start with checking your pupils. So I'm going to use this right here. Use a light and turn that off. Okay, you can just look straight at it for me. Okay. Pupils are equal, round, and reactive to light.
Oh.
I'm going to turn that back on.
Excuse me.
Okay. Alright, so I'm just going to check your eyes. Just look forward for me. So we've got sclera, white, your conjunctiva are pink. Look at your nose, midline. I'm going to pull out my flashlight again. And there's our patent. No evidence of deviated septum. Open your mouth for me. Say ah. Stick your tongue out. Ah, bigger, bigger. Okay. Thank you. Okay, so uvula is midline. Tongue.
Pink.
Pink. Lips and buccal mucosa. Let me see here. All pink and moist. There's no evidence of any lesions of any kind. So I'm just going to feel around on your ears here. Any pain at all?
No.
No pain? Okay. And so if I had an otoscope, which I don't right now, I would be looking inside your ear canal for a gray, pearly, round eardrum, which is a sign of a healthy eardrum. We don't have any inflammation or drainage. Okay, so now we're going to check your lymph nodes. So we're going to check this you can just relax your head. So we're going to check our submental. So just tell me if you have any kind of tenderness, okay? Submandibular, your occipital. Okay, go right here to your tonsillar. A little bit swollen right there. Any tenderness?
No.
Nope.
No discomfort.
Okay, good. So we're going to check superficial cervical. We've got some deep cervical nodes right in here. And then we've got our posterior cervical. And then supraclavicular. So I'm not feeling any swelling beside your tonsil here. Okay. Now we're going to go into the peripheral vascular system. So we're going to start checking your pulses. So we're going to check your carotid pulse on each side. I'm actually going to listen to your carotids for any bruits.
A brewery?
A bruit.
Not a brewery.
No, not a bruit. It's clear. Alright, so I'm going to go down to your brachial pulse here. I'm going to feel both of them at the same time. Okay. And your radial. Okay, they are symmetrical and regular. I'm going to check your cap refill time on both hands. They're both less than 3. Your nails are smooth, convex, and translucent. Skin turgor is quick, which means you're hydrated. Okay, so we're going to move on down to your feet. You can slip off your shoes for me. I'm going to check your posterior tibial and then superior. Okay, and then dorsalis pedis pulse. Both strong, regular, symmetrical. So I'm going to grade your pulses +2. Then we're going to check your cap refill time on your toes. So those are less than 3 seconds and quick. Nails on your toes are convex.
Cut.
Trimmed, yep. Semi-trimmed. Translucent, and skin turgor down here is quick. And no signs of edema. Okay. Alright, good there. Now we're going to go into our cardiac assessment. So we're just going to listen to your heart here. So we're going to start with our aortic. Our pulmonic. You can hear it. The second beat of your heart really strong here. Go down to Erb's point. S1 and S2 are pretty equal. We'll go down to your tricuspid. And then your mitral valve is your point of maximum impulse. This is where it's, where you can feel it, you can palpate it actually. If you can lean back for me, I'm going to see if I can palpate it. Lift your shirt up here. So go over there. Will be in between the intercostal space. So I can barely feel it. So I'm going to grade it as like a +1, maybe +2.
So okay.
No. No. You don't really want to, you don't want it to be bounding. Okay. Good. Okay, and I'm going to actually listen to it on the other side of my stethoscope just to get a better listen. Okay. Now I'm going to listen to your abdomen. Okay, so I'm going to lift your shirt up. Alright, so overall skin looks good. I did see that you had like a scratch or an abrasion that's healing okay. Other than that, no issues with moles or freckles or any questions about that? No? Okay. Alright, so let's to your abdomen here. Okay. It's okay, you can lift your shirt down here.
Seem like you're having a great time.
Okay, so I would say your vowel sounds are active to like hypoactive. They're not really active. So anyway, okay, so we're going to check your right lower quadrant. We're just going to do some palpation here. So right lower quadrant is where your appendix is. The main organ there. Right upper quadrant is going to be liver and pancreas. Left upper quadrant, spleen, pancreas, majority of the stomach. And then left lower quadrant, we're looking at your colon. Alrighty. Listen to your lungs.
Nice. We had that.
Your blister's hurting?
Yes, ma'am.
Alright, let's listen to your
Listen to your heart.
Okay, deep breath in and out. Manage big remove for me. Three.
I didn't have to breathe.
I know. Okay, go ahead, breathe. Okay. Okay, I'm gonna listen up here again. Go ahead. Okay. Bring it for me. Okay, deep breath for me. Another one. One more. And one more on this side. Okay, moving back. Go right here on your side here. Deep breath. On this side. And one more. Okay, so chest expansion is symmetrical. Sit up for me. Our AP to lateral is 1 to 2. So we don't have any evidence of barrel chest or COPD, anything like that. Breath sounds were clear, no wheezes or crackles. And let's check your sinuses real quick. So here's your frontal sinuses. Any tenderness here?
No.
No? What about your maxillary sinuses?
Uh-uh.
Good. Alright, I'm going to do a little bit of chest percussion and then we'll be done. If you just lay back and relax. Okay, so I'm going to go, oh, I'm sorry. I'm going to go in between the intercostal space here. Okay. Why are you looking like that? Okay, I'm going to check this later. Down. Okay. We're done. We're done. Thank you.
Healthy body, healthy mind.